Ever wish you had a crystal ball for your health? Something that could spot a problem before it even shows up.
It's like a heads up before things go sideways.
Exactly. Well, get this. There's this new AI out there, and it's basically doing just that for AFib.
Atrial fibrillation, that
Yeah.
heart rhythm thing, right?
Yep. And it's a big deal because it could be super sneaky, hiding out without any symptoms.
Silent but dangerous, kind of like,
Ticking time bomb.
yeah, ticking time bomb. This AI is all about predicting who's at risk so we can diffuse the situation, so to speak.
That's what we're diving into today, how this AI works, why it matters, and what it could mean for, well, all of us.
I think a lot of people are going to be surprised by this, especially how it digs through your medical history to connect the dots.
Okay, so first things first, let's make sure everyone's on the same page. AFib, atrial fibrillation, what is it exactly?
Okay, so imagine your heart, instead of beating in a nice steady rhythm, it's kind of like,
Glitching out.
yeah, like a little electrical storm in there. It's quivering instead of beating properly, and that's when things can get risky.
Risky how?
Well, when your heart's not pumping effectively, blood can pool and form clots. And those clots, they can break free, travel to the brain.
Stroke City.
Exactly. That's the big danger with AFib, the stroke risk.
And you mentioned something really important earlier, that it can be totally silent.
Oh yeah, tons of people have no clue they even have it.
Which is terrifying because in the UK alone, there are thought to be thousands of people walking around with undiagnosed AFib.
The latest figures show about 1.6 million diagnosed, but that's probably just the tip of the iceberg.
Okay, so that's where this AI comes in. It was developed by researchers at the University of Leeds and Leeds teaching hospitals, right?
Yep, and it's currently being trialed in West Yorkshire. Basically, it sifts through GP records, kind of like a detective looking for clues.
Clues to what, though? What's it looking for?
Red flags, basically. Things that might suggest someone is more likely to develop AFib down the line.
So, like, what kind of things? Give us some examples.
Sure. It looks at things like your age, your sex, your ethnicity, all the usual suspects.
Makes sense.
But it also digs deeper, looking at any pre-existing conditions like heart failure, high blood pressure, diabetes, things like that.
So it's not just one thing, it's the whole picture.
Exactly. It analyzes all these factors together to create a risk profile, kind of like a personalized score.
So let's say the AI goes, this person's got a high risk of developing AFib. What happens next?
Well, they're not immediately rushed to the hospital or anything.
That would cause some panic.
Yeah, no panic necessary. Instead, they're given this little handheld ECG machine.
Like the ones they use in hospitals.
Similar, but way smaller, super portable. They take it home and monitor their heart rhythm a couple of times a day for a month or so.
It's like having a mini cardiologist in your pocket.
Pretty much. And if the ECG picks up anything funky, any irregular rhythms, it sends a signal straight to their GP.
So it's like a silent alarm system.
Exactly. No need to wait for symptoms or book an appointment. The GP gets notified, and then they can decide if further tests are needed.
And this is all about early intervention, right? Catching it before it becomes a problem.
Exactly. Because the good news is there are treatments for AFib. Medications, lifestyle changes, things that can drastically reduce that stroke risk.
Which brings us to the big picture here, the impact this AI could have on stroke prevention.
Huge potential there. I mean, we know that AFib contributes to a lot of strokes, something like 20,000 every year in the UK.
That's a scary number.
It is. But think about it. If we can identify those at-risk folks early on, get them the treatment they need.
We could prevent a lot of those strokes.
Exactly. It's a game changer, a real shift from reactive to proactive healthcare.
And it aligns perfectly with what the NHS has been doing lately. They've actually managed to increase the number of AFib patients getting preventative meds by 8% in the past 5 years.
That's fantastic progress, but this AI could really supercharge those efforts.
It's exciting to think about, especially for anyone listening who might be worried about their heart health.
Oh yeah, knowledge is power. The more we understand these advancements, the better equipped we are to advocate for ourselves, for our health.
It also makes you wonder what other conditions could be detected early on using this kind of technology.
The possibilities are pretty mind-blowing.
It's a brave new world out there.
Mm-hmm.
Who knows what the future holds, but this is definitely a step in the right direction. Thanks for breaking it all down for us.
My pleasure. Always happy to geek out about cool new tech.
And thanks to you all for listening. We'll catch you on the next deep dive.
See you then.
Bye for now.